Thank you so much for the opportunity to be here. I think you'll find my presentation is going to be a little bit different from the other ones in that I'm not necessarily presenting a defined research project that's ongoing or that's been done, but rather instead I'm going to talk about an approach that we use at the University of Waterloo School of Pharmacy to educate future pharmacists in nutrition. And out of that, I am going to raise a number of questions at the end that would actually lend themselves well to research questions. So what I'm going to do today is just give an outline, a very brief overview of our pharmacy curriculum, what's included at the University of Waterloo School of Pharmacy. I'm going to talk about pharmacists' knowledge of nutrition and where they're often expected to have some knowledge of nutrition, and then I'll talk about how we approach it in our curriculum. So I'll talk about how we include nutrition in some of our required courses at the school, as well as an elective nutrition course that's offered at the school. And then I will touch a little bit on natural health products as well. So a lot of times natural health products are kind of lumped under that overarching umbrella of nutrition. So I will touch very briefly on how we also include natural health products in our curriculum. And then at the end, like I say, I'm going to list a number of outstanding questions, and this is where I think there may be some idea or some potential for collaboration and research. So just a very quick overview. We are the newest pharmacy school in Canada. I graduated from the second best pharmacy school, which was Dalhousie. Are there any other Maritimers here? So I'm a proud Maritimer, another one up there. We are the newest school at the University of Waterloo. It's a 4+2 program, so the program itself is 4 years in length. Before being admitted, students need to have at least 2 years of science. Most of them come in having a degree already, though. We have 120 students coming in per year, and they do a total of 8 academic terms plus 3 co-op work terms. The co-op program is very unique. We're one of only 2 schools in North America that offers our pharmacy program as a co-op program, and it's great to be an instructor in a program that offers a co-op program because all your students have some real-life experience that you can draw on. And then the students, as of this year, as of 2015, the students will graduate with a PharmD. Up until now, it's been a Bachelor of Science in Pharmacy, but we've recently transitioned to an entry-level PharmD program. That was a quick and dirty overview. In terms of what pharmacists need to know about nutrition, one of the problems here is that that really hasn't been systematically studied. So it's very hard to find a good publication saying what pharmacists already know about nutrition, what they need to know, what they're often asked related to nutrition. You can find a handful of publications on natural health products, but not really on the broader questions related to nutrition. Nutrition education in pharmacy schools is sporadic. So some schools, if you survey them across Canada, some would include much more than other schools. There are a couple of publications in the US, again, that show that across the US, schools differ greatly in terms of what they include in terms of nutrition education for future pharmacists. Anecdotally, though, again, this is just from my own experience, this isn't based on the research. What I've found from talking to different practitioners is that pharmacists are often asked about things like drug-nutrient interactions. So whenever we say, what do pharmacists need to know about nutrition, that's one of the first things that comes up. It seems like an obvious thing. And that would also include some of the problems that come with drug administration through enteral feeding tubes and how drugs can interact with the enteral formulas. Infant nutrition is often something that pharmacists get asked about. So for example, how to choose an appropriate infant formula, how to mix them, and so on. Pharmacists are often asked about special diets, weight loss diets. They're often asked about weight loss supplements, so whatever's been on Dr. Oz that week is often something that pharmacists are asked about. They're asked about diets for risk reduction, so they've just been told that they have high cholesterol. So what diet can they follow to ultimately reduce the risk of having a cardiovascular event? Things like nutrition and diabetes. So a lot of pharmacists will become certified diabetes educators, and as part of that are more involved in nutrition counseling. And in particular, how to administer insulin so that you have an appropriate insulin to carbohydrate ratio. And then, like I say, natural health products, I'm putting under that large umbrella of nutrition. Pharmacists are often asked about natural health products, and I'll touch on them separately at the end of the presentation. So in terms of how we cover nutrition at the pharmacy school, we have a small number of hours in our core curriculum related to nutrition. So for example, in our introductory pharmacology course, one of the lectures is on vitamin action. In our professional practice courses, that's where all of our self-care therapeutics is housed. And one of the main topics that's covered there is infant nutrition. So again, we go through best feeding techniques, breastfeeding of course being optimum, but we also talk about formula, we talk about things like vitamin D supplementation and so on. And then we have a series of courses called our Integrated Patient-Focused Care series. This is where the bulk of our therapeutics is housed, also things like pathophysiology, pharmacology, and so on. And there we have a small nutrition module in the first course that touches on the basics, just very simple basics of enteral and parenteral nutrition. We talk a little bit about nutrient function and deficiency and drug-nutrient interactions. And then throughout the series as well, as they're going through different disease states, they'll often bring up things related to nutrition. So for example, when they're doing their cardiovascular module, as part of that, they'll go through what diets actually have evidence for risk reduction of cardiovascular disease. So we're all about the Mediterranean diet. Pharmacists love randomized controlled trials. That's where there's some randomized controlled trial data, so that's always what they want to push. We talk about things like nutrition and osteoporosis as well. So pharmacists can always tell you that you need 1,200 milligrams of calcium if you're over 50. They often don't take into account the fact that you get most of that from your diet, so you don't need to automatically get a supplement. So we do talk about the importance of that. And when they talk about chronic kidney disease, they know what nutrients are concerning in chronic kidney disease. They don't necessarily know how that translates to practical advice on what the patient needs to eat, and really are probably not qualified to do so. That's really a dietitian's role. We also talk about nutrition in pregnancy, and really what we emphasize over and over and over again throughout the curriculum is that whenever a pharmacist interacts with anyone of childbearing age, there really is that need to remind those patients of the need for folic acid. So on top of that material that's covered in our core curriculum, we also have a nutrition elective course. It's a fairly popular course. It's a third-year elective course. Usually about 75 to 80 of our 120 students end up taking it because they love the instructor, right? So it includes a lot of topics. And so in this course, I wouldn't say we necessarily go into great depth on any topic, but what we do instead is make sure they at least have some familiarity with a broad range of topics. One thing that I would like to point out is that in this course, we do have a couple of lectures that are by registered dietitians. So we do think it's important that they are receiving a lot of the information from the experts. And so one of our guest lecturers is Mary Donnelly Vanderlee. Did I say that right? A lot of you probably know her here. I was hoping she might even be here today. So as part of the course, we talk about the causes and management of nutrition deficiency. So we talk about certain disease states, things like cystic fibrosis or burn patients and so on, where they're more likely to become malnourished. We talk about popular diets. Again, nutrition for disease risk reduction, nutrition for optimal growth and development. So there we would talk about nutrition during pregnancy, breastfeeding, and infancy. We do spend a bit of time on nutrition-specific disease states, again, things like diabetes, chronic kidney disease, going into a little bit more detail from what was covered as part of the core curriculum. Mary, who I already mentioned, is the one who lectures on enteral and parenteral nutrition, and the students really appreciate her, her clinical insight that she brings to the classroom for us. We talk about supplementation in special populations, so for example, what extra nutrients do smokers need, vegans, and so on. We talk about food allergies, avoidances, drug-nutrient interactions. Again, we go into a little bit more detail there. Functional foods and nutraceuticals is something that's of interest of mine, so we do talk about that as well. We also touch on things related to public health and policy, and I'll talk about that here in a second when I get into the assessment part. Teaching tools are important as well, so the students have to memorize things like Canada's Food Guide, how to interpret food labels, and so on. And then one other aspect of the course that I think is very important is research design. So again, pharmacy students love those placebo-controlled, double-blind, randomized controlled trials. They often don't exist in the nutrition world, so you can't do that with broccoli or something like that. So we talk about some of the differences in nutrition, some of the limitations, and how you need to be able to interpret the data. In terms of how the course is assessed, so like any course, there's a midterm and final exam. We also have debates, and this is where we really get into some of those topics that are more related to public health and policy. So we have debates on things like whether or not restaurant menus should include nutrition information, whether or not there should be a nationally developed front of package labeling system, and so on. So things that tend to be in the news or in the media are what we include for debates. The students also have to do a diet reflection. This is a fairly new aspect to the course. So the students actually have to follow a diet for a week. They can pick whatever diet they want. It doesn't need to be a weight loss diet. It could be a sodium-restricted diet. It could be, a lot of them choose a gluten-free diet. Anyway, for a full week, they have to cover it and then write a reflection paper on that. And that's really been a game changer for the course. It's really made the students realize that in their role as educators, it's much easier said than done. And the students also generate pamphlets as part of the course. So they need to take something related to nutrition and put it in concise, patient-friendly information. The students also used to have to, again, design a research trial as one of their assignments. And I loved it, but they absolutely hated it. So over time, I let them convince me to drop it. We will be adding in presentations. We used to do presentations in the course. Due to time restrictions, we took them out, but I'm going to add them back in the coming term. And so for the presentations, they're going to be on current topics, controversies, and questions in nutrition. Again, things where there's some uncertainty. They need to be able to evaluate the literature surrounding that. I'll touch very briefly on natural health products. So again, pharmacists are expected to be experts on natural health products. If you look at different standards, it's evident that they are expected to be knowledgeable about natural health products, but a lot of times they aren't. So the studies that have been published to date show that pharmacists are not confident in their knowledge of natural health products. And so as a result, we do include that fairly extensively in our curriculum again. And again, that's covered in several core courses. Any disease state we're covering, in addition to talking about prescription drugs to manage the condition, we'll also talk about potential natural health products that can be considered. In terms of outstanding questions, so there are a lot of things. Like I say, so far I haven't presented an actual research project, but I think there are a lot of areas of research. So like I say, we don't know how knowledgeable pharmacists are to date and where the gaps are in their knowledge. We don't have a good literature review of what patients are looking for from pharmacists. And we need to think about how it can be enhanced for pharmacy students and students in other disciplines, and also just how pharmacists can better interact with other healthcare professionals to be able to meet patient needs related to nutrition. So I just wanted to end with some final thoughts. So pharmacists are experts in medication therapy, but they're often relied on as well for expertise related to nutrition. And by providing education and nutrition to future pharmacists, we can ultimately improve health. So pharmacists are viewed as being the most accessible. They're healthcare professions. They are also viewed as being trusted. And so again, by providing that education and nutrition, we can ultimately improve health. So I'll end things there. And I'm happy to take questions.